Just this week, Austin Public Health announced the COVID-19 Omicron subvariant XBB 1.5 has been officially detected in the area. And right now, the variant accounts for more than 27% of all cases nationwide. Joining us this afternoon is Dr. Ogachika Alozie. He's a member of the Texas Medical Association's COVID-19 Task Force and Infectious Disease. And thank you, doctor, as always, for joining us. Let's just jump right into this.
Thank you.
What makes this variant different than the others?
Well, I think it's different and it's the same. I think one of the things that we do need to realize is that it seems as if Omicron and XBB 1.5, right, is a cousin of Omicron. It's out of the same lineage. And so instead of Alpha, Delta, and what we've had before, what we now seem to have is Omicron creating different cousins. It's more virulent or more infectious because as it mutates, it's finding different ways to get into the human body. I think that's the bad news. I think the good news, I may be jumping the gun here, is that because so many people have either been infected with Omicron or have multiple vaccines, we're not seeing the impact that Omicron had originally back in 2021.
So you mentioned the good news and the bad news. How much should people actually worry about this variant?
You know, I think worry is a part of human nature, right? And we're all worried and aligned differently in that. I think if you're above 65 and you're either unvaccinated or only had 1 or 2 shots, you really should get the bivalent booster. There does seem to be some data, whether it's randomized controlled or not, that shows that people that are older do better. If you're a 22-year-old and you've had COVID 2 or 3 times, you've gotten a shot, probably not something that you're going to worry about and you're going to continue with your life. And so I think we have gotten into a place where risk and worry is targeted. And that's really how medicine should be. There's never a one size fits all. This isn't 2020 anymore.
All right, really good point there. And could more variants, doctor, emerge in the future?
Well, we expect that to happen, right? And so once upon a time, there was this thought process that because it was a coronavirus, it wouldn't mutate as much. We've been proven wrong with that multiple times. And so the expectation is, like every virus does, this will continue to mutate. I really believe that right now we're in a good space with the number of vaccines and the amount of immunity we have. Down the line, who knows? If this were to take a complete jump, we may have to look at a completely different vaccine. That's not today. Let's worry about today. If you're above 65, you're immune compromised, please go get protected.
And then lastly, let's just head overseas and we see what's happening in China, the COVID surge happening there. Are we worried about that and how that could play in the United States?
I really do feel that this is a different scenario entirely. Remember, China adopted a zero COVID policy. And so what you're seeing is what happens, or what could have happened potentially in the United States if we had locked down for months on end. They have a population with essentially no immunity, and they have very different vaccines, not the same vaccines we were privileged to have. And so they're now facing the fact that their country needed to open up. And this is what happens when you have a non or poorly vaccinated community, poorly immunized community, and now they have a very highly contagious variant. It's ripping through the country, and it's really unfortunate what we're seeing.
All right, doctor, as always, thank you so much for your time.
Thank you. Have a great day.